And then the other thing I wanted to show you, especially on this, is the rebuild button. And I'll show you an example in just a second. Actually, let's do that first. I'll show you the example I wanted to show you is coming from Plano. And with Meditech, you can't just click the top part. You can't just click room or patient name or age and sort by that person, or like click the provider, like Dr. Crosco and Dr. Kohler and things of that nature. You just can't, unfortunately, do that. So that's what this rebuild button is that you can rebuild by basically any of these designated categories. And so after clicking the rebuild button, you can do different sort keys. And basically what that does is, like I said, you can either by patient name or by room status or by length of stay or by physician. Also, PAs will use practitioner. I apologize, that's how the wording that Meditech uses is practitioner for PAs. And so for this example, basically what I did was I did physician and then I did length of stay. Now you could do, so you can see Dr. Crosco has, 9 patients or so, and he has some that have been outstanding that need to go upstairs, and so he's getting to the end of his shift while Dr. Kohler is starting to be in the middle of her shift picking up patients. And then basically the patients to be seen are at the bottom. So going back to Meditech, just to show you, and again I apologize that can't show you live patients, but just to kind of go through the process, what you would do is you would actually hit the rebuild button and then change sort by fields. This bottom one is the most easiest I've found to do. And then normally what I do here is I actually backspace out and I hit F9. So F9 is what you'll find is your most useful. If there's some sort of open area that you need to put something in, F9 is going to be your biggest thing. So I personally like physician. Now, again, my last name is Brokish. Dr. Goldman's here as well. I put it in ascending order because it'll go Brokish, then Goldman in terms of for providers. He actually may want descending order because Goldman will be flat coming up at the top, and then Brokish will be at the bottom. So again, it just depends upon your last name. But then if Dr. Meek came in, for example, then Dr. Goldman will obviously be in the middle, so it just kind of depends. But you can put that in there, and then again, normally I just backspace that out. And I personally am a room person. You can do length of stay or room. Or, again, it does not matter, whatever your preference is. And again, you can also press F9 for that ascending, descending to have your most length of stay at the top. And so again, you hit OK, and then that will readjust as we showed you just in that previous slide. One of the biggest things questions that people have are, so I've rebuilt this tracker, my patients are at the top, I have it by length of stay, will it keep that way? So you can actually document, you can put in orders, you can do almost anything just as long as you don't change tracker settings. It will actually keep it with that certain order in mind. And so, and some people actually use dual sessions. They'll actually load up 2 different sessions of Meditech, where if you're at a facility that has dual monitors, where the left side will be the tracker board with your patients at the top, and the right one will be more the documentation and things of that nature as well. So that's something that a lot of physicians and providers do as well.